Hello everybody, this is Dr. Zaid Al Aubaidi, a pediatric orthopedic and pediatric spine surgeon. I would like today to talk about something very important, the so-called cerebral palsy. The cerebral palsy is a condition that affects kids and it's simply an injury to the brain centers that controls the extremities. Whether it's upper or lower extremities. Of course, there are many levels of cerebral palsy. The commonest cause of cerebral palsy is what we call it hypoxia, which means missing oxygen for the infants during delivery or shortly after the delivery. And what this due to the brain, that it affects the centers of the brain that controls the upper and the lower extremities. As I mentioned, there are many levels. The very simple levels, it could be just tightness of the tendons of the lower extremities, or it could be to a very high degree where the child would be completely wheelchair bound and not able to stand or to walk. So the treatment available in the world, it consists of physiotherapy. It could be the so-called Botox injections, or it could be also splints or orthotics. So surgically, if we want to do anything about these kids all over the world, we do what it's called tenotomies. Tenotomies is simply just cutting the tight tendons in the extremities to relieve the tension. So now, for our philosophy, we really don't believe that tenotomies is the way through. Because if we understand the cerebral palsy in the right way, the extremities, they have always a side which is very tight, where my colleagues would do the tenotomies for, but there is the other side which usually would be weakened. And doing the tenotomies will not solve the problem, and also not mentioning that doing the tenotomies, it means that you have to redo it again after 3-4 years when the child is growing up. What we do is what we call rebalancing procedures. So the whole philosophy is that, as I mentioned, one side there is tightness, other side there is weakness, so we just transfer the tendons of the tight side to the weak side, and in this way we rebalance the extremities. And we have many cases that has been done through the years, and you know that we have even cases that comes from abroad for this kind of treatment. And as you can see from our pages that there are some videos done for the families explaining that they lost the hope for their kids to stand or to walk again. And alhamdulillah, you can see now that they are walking at least with some assistance. So I would like to encourage all the parents to keep the faith and remember that the treatment is available, and we hope that to help these kids. And it's really like warming my heart to see these kids being wheelchair bound, and after that they are coming walking in the clinic, even if it's with assistance. So I would like to thank you again for following us on the social media, and we're very happy to answer any questions you might have.